In depth this Friday on a new hair loss treatment that also gets rid of a little bit of fat. Talk about a good deal. Doctors say they can now reverse hair loss with stem cells taken from people's love handles or belly fat instead of from their bone marrow. Dr. Randy Shuck has more details.
Joining me now is Dr. Markou. He's going to tell us a little bit about some cutting-edge stuff that's been around for a little bit of time, so that's kind of an oxymoron statement. But yes, the idea is that we're finding that stem cells are in our body, which have a specific role, and we're finding them in more and more places so that we're finding them useful. So, latest is fat cells.
Fat cells,
makes us a little concerned about growing more fat. So let's dispel that little myth right there and go into what a stem cell is supposed to do and how we get these.
Well, what do stem cells do? Stem cells help to rebuild tissue. They help to repair tissue. They go to injuries and they're the builders. They go there and they fix it in the direction of platelets. So when we have an injury, what goes there first? Platelets. Platelets are sequestered to this injury and they release growth factors, and they're basically telling stem cells from around the blood supply to come in and fix this, make this stronger.
So as we're looking at it's a natural response. So
yes.
We're not really making something happen, but as you said earlier, we're amplifying the effects. So if we're talking about stem cells, how many of them run around in our body and what different areas, and then how can we make them more potent?
Circulating stem cells, we don't have that many, but we have many that do circulate at all times around the bloodstream. But imagine concentrating these stem cells with PRP, with a concentrated solution where that injury is, so that now that PRP can tell a whole group of workers what to do, what to fix. That's the goal of concentrating the stem cells, which are found in adipose and in bone marrow. Adipose is a little easier to get to.
And we have a little bit more of it. Some of us more than others. So yeah. So go backwards a little bit on PRP, because that's a kind of a term that we haven't discussed yet. So give us what that is.
Platelet-rich plasma.
And we get that from?
We get that from the blood.
Okay.
What we do is it's a simple blood draw, and we put it in a special centrifuge, which centrifuges the layer called the platelets. It concentrates them. So in that platelet layer, that's what contains your circulating stem cells, growth factors. These are these cells that rush to an injury when someone is injured. So if we use this alone in an injury, in an orthopedic injury, for hair loss, what it does is it basically tells more circulating stem cells to come join and help to repair. We're directly repairing this rather than relying on the circulation to bring it in.
So we're kind of cheating nature a little bit, just kind of concentrating what we have going around and putting it in the place where the injury is, in theory, so that we don't have to wait for it to come. We can actually start it a little sooner.
Yes.
Which kind of leads us to the next statement. What do you use it for?
We use it for sports injuries. We use it for arthritis. It's used cosmetically. In my practice, we use it a lot with the hair restoration part of the practice, with or without surgery. Helps really well to grow back hair in the back. It helps patients keep their hair and helps patients thicken their hair. It's great for the patients that are not really candidates for hair restoration surgery, who really don't have room for new grafts, but who are just thinning, and you see them thinning, a lot of females, and you can just inject the scalp with this, and often it makes enough difference that it makes a big difference, and they're able to style the hair better. The hair just looks thicker and fuller.
So when you put these stem cells in, if you're losing hair, does that regenerate the hair follicles, or does it just decrease the amount of activity that's causing the death?
No, the theory is that it's regenerating the hair follicle, making it stronger and thicker. So by the second option that we have now, that we're using a lot more, by using stem cells concentrated from the fat with the PRP, with the platelets, now we can get an enhanced effect. Now we really have a lot of stem cells in there. And stem cells, as you're aware, they have the potential to become any tissue in the body. A heart cell, lung cell, a bone cell.
Wherever it's needed.
Wherever it's needed.
Now, when we talk about this, you're not getting these from someone else.
No.
This is called autologous. We do it ourselves.
Yes.
And so they come in and you take the pieces, fat cups from one specific place or another. Is there one that's better than the other?
We take from the belly. It's the easiest place to take from. Everybody has a little extra there, most people do. And it's just the easiest, most tolerable, very comfortable place to take from. We just take about 2 tablespoons full. That's all we need to do this. This is not like a liposuction, although it is in taking the 2 tablespoons. Very gentle, minimal discomfort in doing this.
All right, so we take this fat, we take the blood, we spin the blood down to make it PRP, or platelet-rich plasma, and we take this adipose tissue and fat and do what with it?
Then what we do is we mix the two.
So
we take the adipose tissue and we spin that down as well.
Gotcha. All right.
We spin it down to separate the fat cells and to separate what the residue which has the stem cells in it. And that's what we mix with the PRP. We mix it real well, and then we use it in the joints wherever needed, just like we would do a cortisone shot, except we're shooting in cells.
And we're shooting in stuff that's our own self, so it shouldn't cause us any side effects. Is there any known side effects to it?
The only side effects, anytime you put a needle in a joint, you can get infection. Knock on wood, I have not seen it. That's basically it. You got to be careful in some rare cases, blood clots, but very rare.
So who can have this? Because this becomes a real question, is if we're going to give this to a professional athlete, is this on the no-no list or is this considered okay?
This is not a no-no list. This is not a performance-enhancing drug. These are the patient's own cells. In fact, many of the teams are using PRP. You read about it in the papers. They're not doing anything wrong. They're just trying to get that injury to heal. And in my opinion, I believe they need to be more aggressive. We need to catch these injuries before they become injuries. Perhaps if a pitcher is pitching and knows his body, knows something's off, maybe that's the time to perform an MRI and see if something's cooking there. If it is, and you shoot it with PRP or PRP with stem cells to be more aggressive, we might actually prevent that injury. Maybe he'll miss a rotation or two rather than be on the disabled list for the summer.
Sure, but I can't give this to somebody without an injury to prevent an injury, right? There has to be some sort of injury pattern there for the stem cells to be activated to know what's doing, right?
As you know, in medicine, we basically say if it ain't broken, don't fix it. So, you know, I don't believe it's appropriate to just start injecting arbitrarily, you know, to prevent that way.
Yeah. Well, that makes sense, but I know people get a little zealous sometimes, especially in sports, and so we want to make sure that they do it for a good reason and not try to make things better. We're not going to make people the Hulks. We're not going to give them extra throwing power. None of these things are going to happen, but it does help the body regenerate quicker when an injury happens.
Exactly.
Great. Well, I'm sure we'll hear a lot more about this. It seems like it's a popular environment. Thanks so much for sharing with us today.
It's been a pleasure. Thanks again.
Doctors say that process only takes a couple hours and there's very little risk to the patient.